Good evening, everyone. Thank you for joining us here. I am Ishwarya Jain, a research coordinator and youth ambassador at GCTC. I welcome you all to today's program. We have successfully winded up the first session, and now we'll be beginning with the second session. That will be on COVID-19, present scenario and future pathways, wherein we'll be focusing more on the global perspective. The session moderator would be Abantika Ghosh. She is a senior generalist with the print. Before we start the session, I would like all of us to keep silence for 1 minute for the frontline workers and for the people whom we have lost because of this COVID-19 pandemic. I would request you all to please keep silence for 1 minute. Thank you. Thank you all. Now, I would just give a brief about the speakers and then maybe Abantika ma'am will take over. So the key speakers for the session are, we have with us Preeti Sudan ma'am. She's a retired IAS officer who has also been a former health secretary. We also have with us Damu Ravi sir, who is currently serving as an IFS officer. He is also the additional secretary who's handling the COVID situation and also the matters related to Europe in Ministry of External Affairs. We'll also be having with us Dr. Devakanta Pahad sir, who's currently the director at DRDO. And we also have with us Dr. Shakti Bhan Khanna ma'am, who's a gynecologist and obstetrician, infertility specialist, senior consultant in the Trust Apollo Hospital. And we also have with us Dr. Rashid Chotani, who's the Chief Medical Director at IEM. He is the infectious disease epidemiologist working in Washington, D.C. Then Dr. Vinny Kantru, who is a consultant, Department of Respiratory Medicine, Indraprasth Apollo Hospital. Also, Dr. Anil Dutt sir, who's the Vice President and Head of Medical and Clinical Department, Vaccine Research and Development, GSK Belgium. We'll also be having with us Mr. Tehseen Poonawala, who's the National Spokesperson of Indian National Congress. Now, I would like Abantika Ghosh ma'am to please take over. Thank you.
Thank you, Aishwarya, for that introduction. Welcome, everybody. Over the last 16 months or so, India and the world have been through everybody's worst nightmares, and it still isn't over. COVID-19 has taken lives, ripped families apart, exposed social fault lines, and brought health systems across the world to its knees. India is no exception. The country during this second wave is living all the direct predictions that it thought it had escaped after a relatively moderate first wave in 2020. What's more, in the 4 months since the vaccine program rolled out, India is now seen to be struggling to get its policy right, while Indians are playing a morbid version of fastest finger first to get vaccine slots, and governments are trading blames for the evident shortage of COVID vaccines. This is an irony, especially because India is among the largest vaccine manufacturing nations in the world, if not the single largest. Until very recently, we were flaunting this image of a world savior. And then the tables turned. To discuss the present scenario and to understand where we are headed, we have with us today an illustrious panel.
Good evening to all of you, and so good to see old friends. And Abantika, of course, covers our health beat in a different role when I was health secretary, a very sharp journalist, I must say. So nice to be here, and thank you, Shekhar Dutt sir and Tiku and all the organizers for inviting me. Today's topic actually is COVID-19 present scenario, future perspectives from a global point of view. So I will, as member of International Pandemic Preparedness and Response panel, I would like to give you a global perspective and relate it to the Indian scenario. And Abantika, if you can tell me how long I have to speak, I'll try to limit myself, otherwise I'll go on.
Ma'am, about 5 to 6 minutes, say.
Okay, thank you. So, just a little introduction about the panel. So, this was, no, it was the World Health Assembly which actually met and thought that it's, the response to COVID-19 globally has been wanting. And therefore, we must have a review of what the how we can improve, how we can prepare ourselves, because definitely this is not going to be the last pandemic. So under the co-chairs, Sirleaf, Honorable Sirleaf, she was president of Liberia, and Helen Clark, Honorable former Prime Minister of New Zealand, with 11 panelists from all over the world. I was also one of them. We have done actually extensive review of literature, then interviews, heard people, held mini roundtables, and held seminars, tried to meet all stakeholders, and come up with a finding. This report was released on the 12th of this month. It is going to be presented to the World Health Assembly on 25th of May. Please go to the website and also have a look at it. Now, what I briefly want to say is that it was felt that globally we had no mechanism to deal with pandemics. As Abantika said, that for the last more than a year we've been struggling, and today if you see 164 million cases in the world, and with CFR of 2.07%, CFR is case fatality rate. In India itself, we have 26 million cases with fatality rate of 1.12%. So therefore, we need to sit up and see what we can do better now and also for the future. The panel actually went through, as I said, through voluminous literature, evidence, and all that. And what we found was that there is no definite mechanism for any global alert on pandemics. Now, according to WHO, there are actually 10 diseases which could, become epidemics, which could become pandemics. And out of this, 6 are zoonotic. But there is no One Health approach within WHO also. And after more than a year, we don't still know what are the origins of this COVID-19. We're still grappling with it. WHO, though, has sent 2 missions to China, but we've not been able to get a conclusive evidence. So there's still another investigation that WHO will do into it. So what I'm saying, why I'm saying all this is that within the multilateral arrangements, we are wanting in terms of alerts, we are wanting in terms of, ensuring that we wake up in time. For example, the panel found that the human-to-human transmission, for example, you see 29th of December 2019, it was found that it was declared, by the local press in China, that we had these clusters of pneumonia type cases, which were not the ordinary pneumonia. And very soon, actually, even the epidemiologists did do the genome sequencing also. But it was only on 30th of January that this disease was declared as a public health emergency of international concern. And then it took more than a month to declare it a pandemic, actually, and that was 11th of March. So therefore, the panel thinks that February is a lost month. And from Wuhan, China, the cases went all around because we did not have any border controls. We did not believe initially that it could act into a human-to-human transmission. So first lesson is that we must have shared data on any outbreaks on disease, inform global body so that everybody is informed, ensure that pneumonia-like cases which the evidence of human transmission is always there. We must ensure that we have these global alerts. I just want to take you quickly to, we had this Nipah, and as Secretary Health, I handled 2 Nipah outbreaks, I would say, in 2018 and 19, and it was localized in Kerala. It did not go anywhere else. So that also was a zoonotic disease which could have actually spread havoc. And similarly, Zika, we handled in 2020, it was, I think, and also a sporadic Zika in 2019. So what I'm trying to say is that, surveillance alerts have to be in place internationally and nationally. So next thing that we found, and we would recommend as a panel, was that, the heartening thing is that we did find the vaccine very quickly, but there is a lot of vaccine inequity. You'll be surprised to know that the Europe and US, or the developed countries, have actually placed orders for 4.3 billion doses when their population is 1.17 billion. So if you take even two doses each person, they have a surplus of about 2 billion. So that itself needs to be redistributed. That needs to be actually ensure that equity is maintained. India needs it, Africa needs it, and even South America. There's countries which do not have actually not started vaccine in the way even in India that we have. And next is that also there has to be a research collaboration. You see, we have already come up with vaccines, but we haven't come up with a drug. We haven't come up, when we were all clamoring for PPEs, masks, there was no global cooperation in trying to have, help out the countries that needed it. And you all know how in the first wave, India did improvise, have a whole of government approach, and we did come up with our own PPEs, with our own masks, and today we are exporting them. So therefore, what I'm trying to stress is that clearly we need collaboration on and research. I'm sure Mr. Ganguly, who would have been in the first panel, would have also talked about it. It is required so that we start working from now for a possible episode. I would like to say outbreak. I wouldn't want a pandemic to be repeated ever. Next is that, we do need, when we say that the world needs to prepare, the nations need to prepare, then we need a resilient health system. And this pandemic has proved that, it's the rich countries are no better in handling pandemics. So that way, otherwise US and Italy would have done better than India earlier, or would have done better than Singapore, would have done better than Taiwan, or better than Thailand. So it's not that, but building health, resilient health systems, especially I would lay emphasis on primary care, on the preventive promotive health, on the wellness aspects, which in India we have launched since 2 days. Since 2 years. I think that's what is needed, and that will take us forward. Next, I'd like to say is that we have just before the meeting started, actually, Mr. Shekhar Dutt was mentioning about the health workers, the budgets. We need investments in health. We also need to see where we invest this, because we must understand that health outcomes have social determinants. So therefore, it's the entire ecosystem that has to be taken care of. This pandemic has also shown how selflessly our health workers, our doctors, our lab technicians, our frontline workers have actually sacrificed and selflessly worked for all of us to be safe. And I congratulate the organizers that they started this meeting with that symbol of gratitude. And I think here is also the human resource policies also need to be looked at very closely, so that we ensure our health workers, our experts also feel comfortable, have motivation to work, and also they invest their best in finding new ways of treating patients. So basically, I would like to sum up that we need a new global and national surveillance system. We need to invest in preparedness now. We need to ensure that there is a global mechanism. It could be a global threats council, as this independent panel has suggested, and it should be, it should have the will of the UN assembly and the will of the countries put together at the highest level. And we must elevate leadership for global health, and we must have effective national coordination and international coordination. And also there should be pre-negotiated platform for tools and supplies. So with all this, we have to resolve to make it the last pandemic, and if on an immediate basis to ensure that this wave that is happening in India is tackled, and the any wave that comes later, we are prepared for. Thank you.
Thank you, ma'am. So yeah, we would definitely want this to be the last pandemic that has caught the world unawares. Um, and if I could just go to Tehseen Poonawala after this.
At the onset, I'm extremely pleased to be joining this panel, and it was a pleasure to hear the former Health Secretary put her words of wisdom across to all of us, and I hope more people can pay heed to that. And congratulations to you all for organizing this. I don't believe, taking from your comments, Ms. Ghosh, that this pandemic was completely that caught the world unaware. At least it shouldn't have caught India unaware. Let's look at the history, because when we analyze what we need to do in the future and what the globe needs to do in the future, we need to understand where we went wrong. So obviously this started from China, which is in our neighborhood, but the second country to be affected by COVID-19 was not really Italy. I go back to 2020. It was actually Iran, again in our neighborhood. But what did India do? India decided to be unscientific in its approach. It decided to host the leader of another country. It decided to ignore the warnings. It decided to not shut down the airports, not shut down flights from Iran and China. And it allowed this virus to get into the country. I come back to the issue of what our government was saying in February. When scientific minds, when bureaucrats, when the opposition was telling the government that the COVID-19 pandemic is going to be one of the greatest catastrophes India is going to see in terms of human cost and medical cost and financial cost, the Honorable Health Minister of India is on record to say that the opposition is lying and spreading negativity. After the COVID-19 was declared a pandemic by the WHO, the Health Ministry of India said that the COVID-19 is not an emergency in India. This is after it was declared a pandemic. So at some point, the buck needs to stop somewhere. We would think that we would learn from that. But no. Come to November, December, January, and once again, the current central government was patting itself on the back, saying how we've defeated COVID. Now, you know and I know a pandemic cannot be defeated. You cannot wash it away. May I point out, let's leave the semantics out. Let me point out some of the things that are done. Let's leave out the political issues. When they opened up the vaccine from 18 to 44, they forgot to understand whether pregnant women could be vaccinated or no. So you had multiple messages going out, as a result of which multiple pregnant women today are struggling because they simply didn't consider themselves human enough whether they should be vaccinated or no. You've had a Niti Aayog, a government body that said 24th May 2020, last year, there would be no further COVID cases. Why is the Center for Disease Control based in Pune not being used to lead this fight? Why is a research organization leading this fight? Why is the fact that the National Institute of Virology based in Pune not allowed to lead this fight, but it is being led by cardiologists, some of them who are supposed to toe the government line. Why aren't those who are experts in fighting a pandemic not being put forward and their message is not being paid heed to? May I ask you a question, as I've again moved Supreme Court, and I speak from a point of locus. I don't have the knowledge Mr. Shekhar has. I'm sure he has a lot more knowledge than I do. I'm just learning. But sir, there is going to be a third phase because we're 300 and 350 days away from herd immunity. What is our plan for that? What about our youngsters? Let's talk about an action plan of how to avoid it. To avoid something, you require real-time data. Real-time data to understand and real-time monitoring to understand, for example, where beds are available. But the fact of the matter is that the beds in Delhi, in North India, the data provided on the dashboard is not updated and is not real-time. So citizens had to depend upon people like me and other good Samaritans to get them a bed. Why could the government of India not do this? Let me give you another example. You have people in hospitals who are COVID positive and their relatives from towns coming there and waiting outside. They are hungry. They've left everything. Why can't the DMs or the government of India, who has their Aadhaar details, call up those people and provide food to them? Or use the footpath where they are waiting, convert it into temporary shelters so those people can stay there and not have human suffering. The cost of human suffering in the second phase is the greatest tragedy to have to happen to India since 1947. And it would be unfair if people are not held accountable for that. I have had, and you've had, and we've all had people dying because they couldn't get oxygen filled in cylinders. I've had friends, I had refilling centers. I've had people I know standing for 30 hours, Miss Ghosh, standing for 30 hours to refill a 6-liter cylinder. I can understand a citizen of India, a human being dying of COVID. It's understandable. But to die because in the capital of India, they couldn't give them oxygen is unfair of. So you need real-time data monitoring. Let's ask one more point that we need to bring up before. Today, can you tell me or anybody tell me what is our preparedness to deal with this entire COVID? What is our preparedness even now to deal with it scientifically? Let me take you from the past to today. The government encouraged remdesivir and tocilizumab. It encouraged these drugs despite multiple times being told that this may or may not work. People suffered for it. I'm going to speak what's on the ground. People suffered to get these drugs. Now you've had a reaction of these drugs of black fungus and these other cases. Now people are struggling for liposomal and other drugs which obviously cause kidney problems. Now you've had the health minister go and release the 2DG drug, which is actually not even scientifically peer reviewed, and people are now struggling for it and it's not available. Why can't you real time make things real time information available to people? If tocilizumab was not required, why did you make people struggle for it? Why couldn't there have been central guidelines put down across the country to everybody that this is what is to be required, this is not what's to be required? How many people have knowledge of ECMO? Why isn't the government coming up and talking to us about ECMO and the problems that has been caused because of their inconsistent policies and people's lungs functioning? People are searching for ECMO beds. Ultimately, if you want to be a central authority, if you want to invoke the Epidemic Act, something that was done in 1800s, and the Disaster Management Act, and take all control in yourself and not maintain the federal structure, then you've got to be accountable to create a national dashboard that tells you real time where drugs are available, real time where oxygen is available, real time where beds are available, what kind of beds are available, and what treatment is available. That unfortunately still doesn't happen. One last point: hiding data and fudging data does not help the world. It does not help India. It does not help human beings. It does not help the world. We have porous borders with Nepal. We are fudging data. We are sending body bags to Uttar Pradesh. Your data, the number of death certificates being issued versus the deaths being showed don't add up. Ultimately, if we want to beat the pandemic, apart from the technological aspect that needs to come in, must come in the aspect of empathy and being a global player. A global country that is a global player that is transparent with the world. That is the only way India can salvage its reputation. It cannot salvage its reputation by simply hiding behind and saying, look, we will not have a political discussion. We will not blame one man.
Thank you, Mr. Poonawala. Scientific evidence, I think, has been the biggest casualty in this pandemic, no matter which government it is. State governments have made plasma banks. Center has used it in its clinical management guidelines. So, and yes, I completely agree with you there. Getting information out has been a huge task. Getting answers to questions has been very difficult. That is, yes, I agree with that. Dr. Chotani, if if you could come in, sir, please.
I'm online, if you can hear me and see me.
Yes, yes, we can. Please go ahead, sir.
So first of all, let me thank all of you for having me attend this amazing uh, meeting with some really amazing people. The emotions that Tahseen Poonawala just illustrated are, you know, are correct. There are so many things that have gone wrong across the world, not just in India, in terms of dealing with this pandemic. I have been working on this pandemic since February of last year, when I was warning the world that this is a serious problem, and warning the United States that it was a serious problem, and nobody was listening. We had tremendous amount of casualties in the US, tremendous amount of detriment because of this disease. And now India is facing a similar problem. One of the critical things that I have always mentioned is that this is now a humanitarian crisis that India is facing. The globe has faced that. India is facing it in a bigger way than any other country at this point. With on Wednesday, 4,500 deaths. I mean, the largest number of deaths in one day recorded on May. Just a few weeks ago, the largest number of cases ever reported. So yes, there is a problem. There is a huge problem. And one of the biggest problems across the globe, not just in India, but across the globe, has been that the authorities that were not qualified in dealing with the pandemic, who had infectious disease epidemiology knowledge or virology knowledge, were given the mandate to deal with this pandemic. So when you have a dental issue, you do not bring a neurosurgeon to extract your tooth. You bring a qualified dentist to do that. In the same manner, when you have a pandemic or an infectious disease epidemic or an outbreak, you've got to bring in the infectious disease epidemiologists in conjunction with virologists to work together to deal with that problem. Now, having said that, what is really, really important at this point is to make sure that we deal with the problem that we are facing right now as a community. As a global community, we have to unite together, to work together, to figure out how can we move forward. Right now, the critical thing is to save lives. Yes, people have to be held accountable, but that needs to be done perhaps later, in my opinion. Right now, what we have to do from a public health perspective is to work together. There are so many different aspects that we have to think about. What is the disease? How is the disease propagating? Resources have to be allocated to public health. Resources have to be allocated to people who are infectious disease epidemiologists to provide the appropriate and the correct data and have transparency so that the population is aware of what's going on. Problem with a lot of countries has been that there have been mixed messages that have been coming out from governments. I'm just not talking about India. I'm talking about all the other countries, that this is not a serious problem. Things are going to get better. They're trying to calm the population, and a part of the population does not even believe that COVID is an issue. And that is where we have the rubber meet the road, the believers and the non-believers, the people who are going to be, who will go and get vaccinated, and the people who are going to go, no, there is a conspiracy going on, I'm not going to get vaccinated. The people who are going to wear a mask and people who are not going to wear a mask, people who are going to observe the lockdowns and people who are not going to observe the lockdowns. So this has become, unfortunately, across the globe, and let me be very clear that it is not just India, but it's across the globe. It has become, unfortunately, a public health disaster has become more of a political debate than anything else. The naysayers and the ones who believe that there's a problem. Now, what is it that we can do to save lives? Fortunately, the numbers in India in cases has gone down, but the deaths are increasing. We know that deaths increase 2 weeks after you have peaks of cases, so you will have a lot more cases. What is being done to assure that, and it has been done, only 15% at one time, only 15% of the oxygen supply at one time was designated for healthcare in India. 85% was for industrial base. Now, most of the industries were closed. Now, if there was an act that the Disaster Management Act, or the act that we have in the United States that our president took a long time to initiate or push the button on, was to make sure that the government's mandates industries that are now not working or doing something else to develop things that are critical for the need of the population, such as oxygen, such as the vaccines. India is the largest manufacturer in the world. And at the same time, we are seeing a huge problem in terms of the number of people vaccinated over there. India also is not agreeable of accepting other vaccines from around the world. Now, I have been on multiple meetings with the State Department, and a lot of vaccine, a lot of oxygen concentrators, which is a huge problem in India, and some medical supplies as well as drugs have been sent to India. Now, right next door to India is Pakistan. Pakistan produces through Firozsan a program that Gilead has, remdesivir. And they are producing it and they're using it. Why is India not doing something similar? So those are kind of questions that worry me in terms of policy, in terms of how things are moving. So unfortunately, as much as we want to talk about the disease itself, we have to talk about some policy mandates that need to be implemented in India also, so that we can save the human suffering and get out of this humanitarian crisis. I mean, it kills me to even talk about how many people are dying in India right now, and how we can move forward. So I think it is very critical that we all take a step back and look at what was done, what were the mistakes, and then look at how we can rectify that, right? I mean, we still have time. It is not that the pandemic is over. It is not that the problem is over in India. Right now, at this juncture, things need to be done from a policy perspective in India that save lives. There's transparency. People know the data is reported appropriately. Now, as all of you know, the total number of cases versus the total number of deaths in India, I honestly believe that in the rural areas, deaths are not being recorded as COVID. The childhood deaths are not being recorded as COVID because there's not a system. It's not because anybody is trying to lie about it, but there is not a surveillance system that is there that is efficient enough to be able to do that. Not only that, there's not. Another problem that we have across the globe, and that includes India also, is that we do not have enough surveillance for genetic markers and trying to figure out which strain is circulating. So that is something so important at this particular juncture, to find out what are the different strains circulating, and very strong surveillance on that, so that we can understand if there are any emerging strains that the vaccine or the drugs that we have so far are not going to be effective against. So those are the kind of things that cause issues and problems. And I just hope that with all the people, the brain matter that is here today, and the brain matter that was at the previous session, which was just an amazing group of people that I listened to, can come together to put together a policy, to put together some kind of direction as to how we can make things better. With that, I would end. Thank you so much.
Thank you, Dr. Chatani. Yes, genome analysis of the virus is a problem. We have just done analysis of about 21,000 samples till date, and we are reporting some 2 to 3 lakh cases right now, and that's like after it's gone down. So that's a problem, certainly. If I could go to Mr. Damoor Ravi.
Yeah, thank you so much, and good evening to all. And I would like to express my deep appreciation to GCTC for giving me this opportunity to be on this panel and the distinguished panelists. Shekhar Datta sir, Aditya, I thank you for keeping me in this, and also Preeti Sadan madam, I worked very closely with her during the first wave. But let me get you the broad perspectives. But I'm not a specialist, I'm not going to specifics of it, but more of the broad perspectives as to how this whole pandemic was handled last year, both at the diplomatic level and how it was a whole of government effort. Now, what we understood was that this pandemic was quite different. The world had seen many pandemics, many epidemics, a different sort, but this was one which never respected borders and never respected any nation. It did not spare anyone. I think that was one thing. And it also conveyed to us that a pandemic of this nature requires global action, collective action, and cooperation, and one should be prepared for the contingencies of the future. The last 1 year has also given us a clear indication that health cannot be seen in its isolation. You have to see it in the whole context of the economy and how it would have ramifications and implications for the other sector. For a very mere fact that the world GDP had taken a beating of 2%, and then many countries have gone to negative growth rates, except for one, which is China. About 400 million people around the world have lost their jobs, direct jobs, and indirect jobs are much more. Tourism taken a beating, went down by losses of $1 trillion. So that is the magnitude of the crisis that the world had witnessed last year and continues to witness now. Now, let me explain to you in the first way. Now, the speaker earlier had said that in India was not prepared. Actually, India was one of the first countries to have taken early action. We had, in phases, closed the borders. We closed the airlines coming into the country. And it was the East Asia, then we moved to Europe, then we moved to Iran. So various locations we started to close the flights that were coming in. Every incoming passenger were monitored. Then we had to go in for a full, complete lockdown. So there was a planning behind it, and it was a whole of government approach. And Madam Preeti Sadan was the leader. She led the leadership for the whole thing. And we were able to do a lot of work during that time. And let me put it on record that it was not easy. India, as complex a country that it is today, with so much of population, so much diversity, so much of logistic challenges around, we had to do it as a one government approach reaching out to. But there were, of course, gaps. There were, of course, deficiencies. Every country faced these deficiencies. Every country faced this challenge. Even the developed world, which is so good in the standards of health and infrastructure, had to also face these challenges. What we did in the Ministry of External Affairs, we set up a COVID cell and a control room. We thought that it was important to first reach out to Indians who were stranded outside. We need to communicate with them. We need to assuage their fears. We also had to do the evacuation of foreigners who were stranded in India, in the remote corners during the lockdown period. We also need to do the medical diplomacy, vaccines. Medicines had to be shifted out, hydroxychloroquine, paracetamol, all this had to be sent while we were looking after our own people, but we also had to reach out to other countries because they look up to India. This was all required a coordination, not just the central government, it involved coordination even up to the state and the union territory level, involving quarantine issues, testing, uh, issues of logistics before boarding the flight, after landing. So this was an enormous exercise in which our missions abroad were fully involved in this coordination activity. Now, let me tell you about the second wave. Now, the second wave is a completely complex issue. Of course, many would say now, argue and debate whether we were taken off guard and we had no anticipation of this. But I believe the second wave also affected equally the countries in the West. These are developed countries. The wave moved from there to here, and it came in so sudden that we are seeing now the devastating consequences of it today. But MEA never closed the COVID cell. We continue to maintain the COVID cell. We had planned that perhaps, at some time or the other, if there was a need to evacuate Indians from abroad, we had to bring them or whatever, we had maintained that COVID cell. So a lot of lives were lost. But today what we are seeing is the responses from around the world. Countries of nearly 50 number have reached out to India to help us with supplies. And with medicines and medical equipment are pouring in, and we are in the forefront of coordinating that relief supplies coming in from abroad. Now, this is all a matter of goodwill that India has earned over a period of time, because you cannot, the world knows that this requires a collective action. You cannot let India fail, because if India failing would mean that another country would also fail. So there is a lot of mobilization of efforts to ensure that India is able to contain this, tackle this. So that is at the back of the minds, and also because we are 60% of the world pharmaceutical medicines are produced in India, 60% or so of the vaccines are produced in India. So we are still an answer for the global health solutions and problems. So there is this fundamental feeling that nations need to help each other. Cooperation, collective actions are very, very important. But let me come back to the whole issue of diplomacy and how we are looking at the entire concept of diplomacy. The new parlance are entering into our diplomatic interactions. The health diplomacy, the COVID diplomacy, or we have the vaccine diplomacy today. Our diplomats would need to be more prepared to take these challenges, to understand these challenges. They would need to know where the source of medicines, how the supply chains operate, and how do we ensure to keep the supply chains open. We also need to be active in the World Health Organization, institutions like even WTO, World Trade Organizations, because if you need to have a rapid response to a epidemic or a virus breaking out somewhere else, you need the World Health Organization to respond to it more quickly, to give an early alert. And we need flexibilities in the TRIPS under WTO. We need to know what exactly are these provisions that need to be invoked for making medicines available for a large number of people around the world. So diplomacy has changed. In the Ministry of External Affairs, we are now getting ourselves to developing this kind of a thinking in a well-coordinated manner. But we also need to be wary of certain challenges, even for diplomats. What if the nations become much more conservative, much more restricted? They begin to think that, okay, let's save our own people first. That could be one challenge for us. And how do we tackle that? Research and collaborations. If countries don't want to give the ingredients for making of the vaccines, and Serum Institute faces this problem with the United States. There are ingredients, raw materials which need to come in. So you need to have supply chains open for that. 280 ingredients are required for making of a vaccine. That is the complex nature of the whole medical world, and the vaccine development is not a simple process. It's a very, very complex process. So we need to be understanding how to make these complex operations operate and work. So you need to develop relationship while at the same time you are working towards finding solutions, not just merely for your country, but I think it is a global solution is required to ensure that these viruses of this nature are not affecting the humanity in the long run. Thank you very much, sir.
Yeah, Mr. Poonawala, you wanted to say something?
Yeah, just to the earlier speaker, I just had one minor question that it's nice that we're speaking about diplomacy, and it's fantastic. I think the world must come together. But how do you comprehend diplomacy? For example, you say that the US has 280 ingredients for serum that needs to come in, but yet the government of India did not allow Pfizer and Moderna to come in only because it wanted to promote a local vaccine. So I think at some point when we talk about a global outreach, which is right, I agree with the speaker, then we must look inward and say we cannot be inward. We also must be accepting of others. And then you say the bridge trial won't happen, and then you allow them without a bridge trial. So I think that it works both ways. It cannot be a one-way street in diplomacy.
I think I want to intervene here. We must know the details of what we are speaking. mRNA vaccines, Mr. Poonawala, require a cold chain of minus 20 to 30 degrees.
That's true.
We do not have that cold chain. Okay. Next thing is that it's not as if it was available for, as I told you, 4.3 billion doses have already been requisitioned by the developed countries. It's not that it's easily available. It's very easy to criticize, but we must know that there are very complex issues involved.
May I please answer that very quickly, because I have to leave. Yes, ma'am, of course, this very quickly. Yes, ma'am, of course, I know the technology that is used. One of my closest friends is building India's first RNA vaccine in Pune, Genova, in the MCure factory. That's not the point. The point is, if you say in November we didn't have cold chain technology, which I agree with you, did we miraculously get it in March that we've allowed them to come in? The fact of the matter is we goofed up in not placing the order, but I don't want to make this political. We promoted an ingenious vaccine. We therefore did not allow Pfizer and Moderna, and now we can blame anything. The cold chain technology is not coming now. We should have been an open market. You've exported vaccines and now say have a global tender to import vaccine. That is the question that is being asked.
Thank you, Mr. Poonawala. Mr. Datta, you wanted to come in.
So again, once again, like everyone, it's an honor to be with you. I learned a lot from the discourse that happened just now. But I have a congenital anomaly. I prefer looking at the future than the past. right? So the past we will have time to introspect, post-mortem, analyze, learn from, and we should continue doing that. Now, where I am coming from, I was talking to a group of postgraduate students at a teaching talk, and that was like 2 years ago. And somebody had asked about a pandemic. It was in the context of the H1N1. And I remember saying that pandemics are a mathematical certainty. We've had them before, we'll have them tomorrow, we'll have them again. Pandemics will never go away. Organisms might change and evolve, right? And that time I said that if we had to have a pandemic, probably today is the best time to have it. Imagine if this had happened 20, 30, 40 years ago. Yes, on one hand, we didn't have the aircraft as many to fly people around, but on the other hand, we didn't have the technological tools we have today. We just heard about the messenger RNA technology, and I happen to be part of a group that works on that. I can tell you, for the first time now, we have this new technology which has actually gone into tens of millions of arms. It has happened. And all that has happened in 1 year. I've been a student of vaccines for the last 30 years. Not one vaccine am I aware of which has been produced in such shortened time frame and with such great efficacy and data set available. So we have come a long way. I mean, all is not lost. Yes, we will learn our lessons, we'll do things better, but it's also important now to reflect on one important thing, which I think every COVID discussion I've had, I haven't heard us thinking more on that. Do we realize that 85% of children who die of infectious diseases today do not die from fancy diseases for which vaccines are not available? 85% deaths continue to occur today as we speak from diseases for which excellent, safe, and extremely affordable vaccines are available. So the problem is, to a smaller extent, the vaccine, to a greater extent, vaccination. The best vaccine is going to do nothing if it stays in a refrigerator or on a cold store. It has to reach out, right? With COVID, what we have seen is well documented by WHO, by other organizations, POW, etc., country ministries. The routine immunization coverage has dropped. And we should not underestimate the impact of that. If COVID, we say, has killed over a couple of million people by now, we should know that about 350,000 children die every year from diseases which are totally preventable, and that's every year. If we counted just 10 years, we crossed that 350 million mark straight away, or 3.5 million mark. So while we are speaking, new babies are being born. The world gives birth to about 137 million newborns every year, right? And as a pediatrician myself, I worry about them. I worry that these are children who are coming into our world with the infrastructural pressures we are facing today, rightly so, because we have to manage the problem on hand. We are running a risk that many of these children will not get their routine, and they are not getting their routine immunization adequately. So we are rapidly accumulating a pool of susceptibles, and goes the pandemic. Right now, people are at home, people are not mingling much, disease transmission of other things has gone down a little bit. We all have evidence of that. But goes away COVID, all this pool of susceptible is firewood for a forest fire. So we are looking at a measles outbreak happening, we are looking at other outbreaks happening. So that's one thing why we talk of COVID. And yes, there are a lot of experts. Professor Chutani is one of them, and they have been working so much around it. I'm sure we will get to the other side, yes, some before the others, but we will. But if we neglect the routine immunization, we are not going to get to the other side. And if we get, it won't be a pretty sight. The second and last point I would make is, what is the future? Where are we heading? 1 year back, we didn't know. If you had asked me this question 1 year back, I said, I don't know. But today, I think most of us know with reasonable certainty that vaccination in some shape or form for COVID is likely to continue in the foreseeable horizon. Many reasons. First of all, the coverage still is inadequate. Newer strains, as you just discussed, continue to evolve and will evolve even more if the disease transmission continues and they have the opportunity to intermingle and mutate. That will continue to happen. Vaccines do not provide lifelong immunity, the current vaccines at least. So there are enough reasons to believe that we will be needing that. Now there we have another good news that we have faced recently. The regulator's perspective has also changed a lot. No time in history do I remember the US FDA giving an emergency approval or any approval for that matter with this degree of exigency and speed. And other regulators have learned from it. That will help. And I think it won't totally change back to the COVID era, but much of the lessons learned during this period are going to be applied to future vaccine developments for sure. We can look at an era of combination vaccine. We take a flu shot every year. Who knows? Why can we not think about a future in which you have a combined vaccine containing flu and the coronavirus antigen in the same shot? It has been done for a lot of other vaccines. It doesn't exist today, but it's very, very feasible from a scientific perspective. The last point I would point out is to Madame Ghosh. I believe you are a journalist. I think our friends in the media, in journalism, have a greater role to play. If we look around the discussions that have taken place on vaccine safety, and I'll be the first one to say safety for me is paramount. I'm trained to say above all do no harm. But having said that, we cannot confuse 7 billion people with mixed messages coming out of multiple sources. And obviously, media colleagues are having a much better reach to the population than you and I would individually have. So we hear about this vaccine can reach up to this efficacy or not. Any licensed vaccine is a good vaccine. Regulators would not license a bad vaccine. They dare not. So instead of picking and choosing and discriminating between 90% for a Pfizer vaccine and 70% for another one, I think those are redundant. They are new topics at this time. We need to simplify our messaging. We need to say all licensed vaccines are safe and effective. Yes, there is a probability of side effect, but that is with everything. With some vaccines recently about the thrombotic thrombocytopenia, we heard about 1 in 1 million. And come on, there are more chances of dying in 1 in 1 million from many, many other ways, COVID included, right? So we need to get that messaging straight also. So in the short term, I would say I see two solutions worldwide and more so for India. Not underestimating the power of routine immunization or not taking eye off the ball there. We have much to pay at a later stop on the road. One. The second one I would say is all of us, in whichever capacity we work, we spread this message of positive message on vaccination. And to say, forget about the brand, forget about the things you hear on TV. A licensed vaccine has been looked at by authorities, by experts, has been proven to be safe and effective. Go ahead and take it. So I stop with that, and if you're...
Thank you, Dr. Datta. Yes, we are still actually awaiting the final estimation of how much our family planning services and routine immunization services have been affected in 2020. We are still awaiting that figure. But if I may comment on what you said about the media, I agree with a lot of what you said. But here's the thing. When the government of India increases the second dose gap to 12 to 16 weeks on the same day when the United Kingdom actually abridges it and says that we are doing this because of concerns about the variant of Indian origin, do we have a choice but to contribute to that mixed messaging, sir?
It's a very easy answer. This is not the first example in the world where different countries have recommended different schedules for their vaccination. You know, vaccine intervals and schedules are a function of many things. In India, for example, we give DTP at 6, 10, and 14 weeks duration. In the United States, we give at 2, 4, and 6 months duration. So there are immunological factors, there are epidemiological factors, there are factors of the infrastructure or the programmatic factors. So a lot of things play into that. So I don't think it's as simple as saying the UK government said this and so the same must apply to A, B, or C country, right? But the point I was making was not even on that. The point I was making on is, did you know that there are very few vaccines today which talk of 90% effectiveness? Very few. Believe me. Do we know about the oral polio vaccine? The efficacy per dose is calculated to be between 9 and 11%. 9 and 11. BCG, the famous vaccine for tuberculosis. Indian studies, Chingalpur trial, has shown a minus efficacy. So the control group actually had less cases than the treated group. I mean, these things will keep happening. That is deep science. People like us are paid to discuss that for a living. But when it comes to public health and public communication, particularly in vaccines, where we already know there is this vaccine hesitancy bar that every day we need to climb, and it gets higher every day. I think simplicity of message there saves lives. That is what I'm saying. We have seen that with polio eradication, we've seen that on measles vaccine, we have seen that when you have some adverse events, some deaths following immunization, related or unrelated to vaccines. We've seen that over the years, over the decades. So I think we can certainly get together and bring in that video. We'll take away one confounding element. We will not solve all the problems. Yes, oxygen will have to still be done, like people mentioned. ICU beds will have to be done. Doctor-patient ratio will have to be fixed. All of that will have to happen. But right now, in the situation we are in today, we can very easily address a few small bites that are available for us to chew on. That was the point I was trying to make.
Thank you, sir. The problem is vaccines are not available. If I could come to you, Dr. Vinny Kantru.
So I would like to get in certain facts regarding the vaccines which have been raised. I would like to say that there has been vaccine hesitancy, not only in the minds of people who we are going to vaccinate, but also in the minds of manufacturers. You know, when somebody manufactures a vaccine which come in with an expiry date, they do think that the data which had come in at that point in time was not sufficient to produce it at a mass scale. You know, the studies were still going on. We didn't know the efficacy. We didn't know whether this would be safe to be used on a mass scale. So this I'm talking about 2020, late 2020. The first vaccination which was done in UK was the Covishield, and it was on December 14th, 2020. So to say that the mass scale production could have been started earlier and we would have placed our orders earlier is a bit too enthusiastic, because the studies were still on, right? And the studies in pregnant women, they came in later. The latest data which has come up is in the month of I think April 2021. So we couldn't vaccinate the pregnant ladies in the initial phases. So that is not how the medical science works. It is the most vulnerable who are vaccinated initially, because in the first wave we did see that the most affected were the ones who were more than 45 years of age. So this profile has changed a bit in the second wave, where we are seeing more younger people being affected. There may be many reasons, a number of reasons, of course, which we need to study further and find out why is it happening. Is it because we have vaccinated our elderly population, or is it a virulent virus which is attacking the younger population? Many reasons. So I think it's a bit too enthusiasm to say that the vaccine could have been ordered previously. This could have been done. Of course, I'm not advocating or saying people have not done any wrong. Everybody has done wrong. Everybody has got fatigue. You know, from last year we have seen wearing a mask has been difficult. Coming on to the second year with a mask is a bit too difficult, and we are not staying at home. The people have been complacent. They haven't used masks. They have gone out of their houses. They haven't maintained any physical distancing. So to blame a particular government or certain set of people is not the right approach, I feel. And also, I think world over, COVID-19 has brought up certain things in the infrastructure. Even the US was, as pointed out by Dr. Chotani, that even the US couldn't handle the second wave in a way which it would have been possible for it. So that's what I want to say. And definitely we need to get things in place. We need to ramp up our infrastructure. We do need to vaccinate our people, which is being done at a faster pace. And we do need more research in terms of what is the origin of the virus. The moment we know how it originated, we might as well know how we can treat it well. So that is what I want to reiterate.
Thank you, Dr. Kantru. Yes, and I think I agree, this is not the time to trade blame, but at some point of time, India will have to look at this question of, every country has had a second wave, but has anybody had a second wave this huge after vaccine rollout, 3 months after vaccine rollout? That's a question we'll have to answer at some point. That brings us to the end of the remarks of by all our panelists. So I would like our audience to send in their questions in the chat box. And meanwhile, I had some questions that I wanted to ask. If I may come to you, Mr. Damuravi. So US is getting ready to export 10 million doses of COVID vaccine. And are there any hopes that India would receive, bulk of those? There have been some reports. Is that correct?
Yes, I think there was an offer in the beginning that in US would give about 20 to 25 million doses. But I think there are some issues there. There are internal issues within the US, and that needs to be first sorted out. We have also made a request for making the supply chains open, particularly the ingredients for making the vaccines in India. Those ingredients also are very, very essential items for us to be able to scale up the production here. So these are all in talks. I think there are some technical issues would need to be overcome before these can be shipped. So I'm not aware and I'm not privy to that technical details and discussions, but hopefully in the days to come.
Okay. Thank you. Dr. Shaktiman Khanna?
Yeah, can you hear me? Can you hear me?
Yes, please go ahead, ma'am.
Okay. You see, I was just wondering the future and all about this. It is such a political issue for a gynecologist and a doctor to talk about these things, and that too in a forum like that. It doesn't behold. As far as a doctor is concerned, our aim is to see to it that as a gynecologist, I'm not even a virologist and immunologist, as we have to see how can we cope up with it. What should be our future strategy? What should we talk to the people? How should we see to it that it is not as bad as it has been? And as far as I'm concerned, my idea is that we should make small groups so that we can forewarn the community as such. We have to do prophylaxis, prevention rather than cure. By the time, because you see, this COVID germ vaccine, this virus is changing so much, and that's why the medicine which is on today is off tomorrow because it doesn't work. And by the time you make another medicine for it, and then that doesn't work. And same is the case for the vaccination. It's fine that we are vaccinating, and it should be, but we know that as far as the pregnant woman is concerned, as Poonawalla was saying, he was saying all wrong. In pregnant woman, we don't give any vaccination till she goes into the third trimester. We don't give into first and second trimester. We have delivered patients here. We have even written 1 or 2 articles on pregnancy in the COVID women. And we have seen the passage of the COVID to the fetus, to the baby, is very, very low. Hardly ever or low. And if at all you can treat them, and there was hardly any death of a mother or a child or a fetus in this. So as far as the woman is concerned, pregnancy, basic thing is that we have to prevent it. We have to see to it in the community We should make small groups and tell them what is the prevention, what is the prophylaxis, and what vaccine should be done, when should be done, and whenever, and then talk to the people in general, especially in the villages and all. What, how can we recognize the disease? What are the early symptoms? If you have a bit of cough, if you have really some fever, if you have throat pain, as we all know, have to make it to those people, have to talk to them. Whole community in India doesn't see the TVs. Whole community in the India, all women in the villages, they are not on WhatsApp groups and social things. So somebody has to go and talk to them. Now there are small centers. There a doctor and one nurse will be there. How can they go? So my idea is that make small groups of the volunteers, tell them what is to be done, let them go to the villages, talk to them that what is the prevention, how to use a mask, what mask to use, what are the early symptoms, and come to the doctor when it is treated and get treated. And don't get treatment by WhatsApp groups. These days, what we are seeing in the hospitals, that all patients are coming, they have had treatment because they have seen on WhatsApp, take this medicine, now take this, that, and now you have fever, take this, which is all wrong. And that's what is causing the problem, the chest problem, the lung problem and all. So my take on this is that prevention. And number two is that people are having so much of depression because of this. So we have to see to it that we do something for that also. So we have to tell them that focus, let them focus on something good. Let them do some work on computer, if they can have computer games. Let them talk to each other, so that the mental tension, which is now a very important part of the COVID, is there, and that has to be done. This is all what I want to say. These are my aim, is to have talk to the people what is prophylaxis, talk to the people what is vaccination, talk to the general community in general in the villages and small districts, which vaccine, when to be taken. There was also a question that is it that we are now saying that after 3 months we should have second dose? Is it because of the vaccine is not available? You see, my brother is working in America and he is in FDA working on this only. I got the first vaccine. We got Covishield. And then after 8-12 weeks, we said, he told me at that time, please take it after 3 months. Don't take, because we have seen it is better. I said, whatever is here, whatever they are doing, we will do that. And now when it has come, everybody is saying it is a political game. One doesn't want to listen to these arguments. These are silly arguments, and by this, the community in general, then they don't take part. What happens to a villager? What happens to a woman there? She will say that I won't have vaccination, my child is going to suffer and all. So this is all what I want to say. Thank you.
Thank you so much, Dr. Khanna.
I can add a line to what
Dr. Chotani, you want to? Sorry.
Yeah, I think she said something very important for all of us. Thank you, ma'am, for saying that, which is that prevention is a multifactorial effort. Now, when you take a malaria vaccine, it doesn't mean you stop using the mosquito net. Because if you use the vaccine and the mosquito net, you first have less mosquitoes biting you, and on top of it, the vaccine protecting you. So ma'am raised a very important point, and which I think has a chance of being forgotten as vaccine will ramp up and the disease will slow down, as it will over time. So I would suggest that's a very good point we should note, and the how, of course, the group can decide, but the point was bang on. We need to spread that message of rest of the precautionary measures, the distancing, the mask, the face covering, the personal hygiene, the hand washing. All of that will augment the effectiveness of the vaccines we use.
Ma'am also made a very important point about people not being on WhatsApp groups, and I can't help commenting that we are attempting to vaccinate 90 crore people through a CoWIN platform when our internet penetration is just about 60 crore people. Dr. Chotani, you wanted to come in.
Well, thank you so much. I apologize, but I have to leave. So I first of all want to thank all of you for having this very, very, very important discussion. One of the things that I would like to emphasize on is that, as I leave, please focus on the current problem. Let's not talk about everything else that is out there, right? Let's focus on the current problem. Media is going to be open and fair. They have to report everything, irrespective of whether that information is, proven valid or not valid later on. News comes out, people need to know that information. If the media is not reporting it, WhatsApp will report it, by the way. So let's not argue about that. Let's not argue about, the refrigeration that was not available in India, for the cold chain. Let's make sure that provisions are made that those things happen. Let's make sure that the vaccine that is being developed in India, and largest manufacturer in the world, that we are able to distribute the vaccine appropriately. So manufacturing is happening, but distribution is another problem. The supply chain has to be really, really, worked out, and then going to the disbelievers, making sure that vaccine hesitancy is not there, making sure that the right message from the appropriate sources, one critical source, pick whatever it is. In the United States, we pick Dr. Fauci, right? So you got to pick a Dr. Fauci in India. Make sure that that person is dependable, trustable, and then have that individual spread the message. Make sure that you are looking at the rural population, which is the largest segment of the population in India. Making sure that they are getting the right message, they are getting the appropriate healthcare. Making sure that India comes up with policies that is going to increase funding for healthcare, infrastructure development right now, making sure that the appropriate supplies that are being the medical diplomacy, what you talked about, some of you talked about, is being implemented properly. We all have to work together and not quarrel amongst each other who did the wrong thing, because none of us did that, right? So these were people who came from some other hemisphere in India who are making those mistakes. So our job should be to figure out a way that we can all work together, whether I'm sitting in the United States. To be honest about it, I was born in Pakistan, and I'm attending a very, very, very Indian meeting right now, right? It really, really should not be a limiting factor, right? If you have people that can help assist in any capacity, you need to reach out to them. Doesn't matter if they're living in Timbuktu, right? It is an effort that needs to be. It is a problem that needs to be solved, and we can only solve it if the global community, irrespective of race, ethnicity, religion, whatever you want to call it, come together and work on it, because we do have the expertise. If you think about it, India produces one of the best scientists in the world. India has the largest manufacturing in the world, which is FDA approved, by the way. How many countries can claim that? So many positive things going on over there. We just have to put all of those pieces together and work together to solve this problem. Pointing fingers at this point is honestly not going to help. We know people made mistakes. There's no question about it. Let's not do that. Let's move forward. Let's try to find solutions. So I hope that all of you can, together can come up with, and as much as you need my help, I'll be more than happy to assist, some policies that can be, pushed forward to the government, which are not politically based. Those are based on public health and knowledge of infectious disease and epidemiology. And moving forward, we can all work together, and hopefully we will never have to face something like this again. But as some of the speakers have said, and as I have always said, we will have another pandemic. So let's be prepared for it. Let's work together to make sure that the devastation that we are seeing in India and all across the world is not this, we will have people who will unfortunately die of infectious diseases, but let's make sure that it's not a calamity that we are seeing today. With that, I thank you so much. Really, really appreciate everybody's comments and having me part of this conference. I have to unfortunately run right now, as Let me claim a little bit of victory over here from my perspective. So I've been putting together centers, vaccine centers in Florida and Virginia. I've got 8 in Florida and about 8 in Virginia right now. And through that effort, through being the chief medical officer for all of these centers, today I can say that we have vaccinated 600,000 Americans. And I'm really proud of that fact, to be part of that equation. And I want all of you to be part of that equation, to be able to claim that victory, that you were part of a solution and not part of a problem. So thank you so much.
Thank you so much, Dr. Chasani. We have a question from Ning Panmei. It says, what future plan does India need to plan ahead post-COVID in regards to national security, both traditional, non-traditional?
So I work on, so my background is counterterrorism, in all honesty, and I have always worked on it. One of my mentors, my mentor, Dr. D.A. Henderson, has obviously worked in India with the council in the past, who trained me on these things. And one of the things that I've always considered is that, when we talk about counterterrorism, I've always said it could be a man-made pathogen, or it could be a naturally occurring pathogen. So both of those things fall in the same bin for me. So in order for me to fight infectious diseases, or of whether they're man-made or they are naturally occurring, you have to come up with the same strategies. One of the most important strategy for that, then that is something that I developed in the US in 2000, was to come up with an early detection of bioterrorism, which actually took influenza as the background and then looked at all of the different diseases. And then subsequently, I worked on SARS, when it first appeared, and MERS, and added them to that equation. So, we add all of these infectious diseases. So we have to have a very robust surveillance system to be able to capture what is going on. This surveillance system needs to be geospatially based. And I have worked on developing a methodology that is not, uses diagnosis, but it's called syndromic surveillance. And syndromic surveillance is a much easier way to kind of capture what is going on in the community from a geospatial perspective. And those are the kind of methodologies which are publicly available now, need to be implemented in India and other countries, so that the epidemiologists and the decision makers can see very quickly on a day-to-day basis, hour-to-hour basis, as to what is going on from an endemicity of a circulating pathogen in a country. With that knowledge, moving forward, adding the genetic sequencing element to it in terms of what are the different strains that are circulating, one can actually be more aware of what's going on and provide interventions, targeted lockdowns, targeted whatever it is, in order to deal with that. But for that, the nation has to invest a lot of money, which will be a small fraction of the amount of money spent on other programs. And I'm not going to go into the other programs, but you all know, how much money GDP is dedicated to healthcare, how much is dedicated to public health. Those numbers have to increase, and the right people need to be running those institutions who bring background information and knowledge that they have now learned or have developed in other countries, in developed countries, because it is happening in developed countries, and it is not happening in countries like Pakistan, Bangladesh, Nepal, India. So that is where the brain power is being pulled away from to other countries. That brain power needs to come back, like what happened with India in IT, right? Brought back all of those people that were savvy in IT, and guess what happened? India became one of the big IT hubs in the world, right? Now you've got to bring people back that are in medicine, public health, infectious disease epidemiology, and are experts in this field, to develop programs, to develop these institutions that are better than perhaps CDC. It is not something that is not possible. It is possible if investment is there. So that is what India needs to do, all the other countries need to do, and that is how the future can look better. building the healthcare infrastructure, building all the surveillance, building the public health measures that are needed. Thank you.
Thank you so much, Dr. Chatani. I, I have a question for Dr. Kantru. We are hearing a lot about this black fungus currently, and it is emerging as almost as big a challenge if what I hear from my doctor friends is correct. So, ma'am, can you tell us what is it that makes it such a big threat, and why is India suffering from it so much? Are there any reasons? In terms of hygiene or anything else? I mean, I can't think of anything else, but is there any other reason apart from this thing about diabetics and steroids and all of that?
See, black fungus is something called mucor in medical language, and this is a fungus which happens or causes disease in somebody who has got a weak immune system. So weak immune system is something which can be natural, or it can be acquired in terms of certain diseases like or AIDS. Like we have certain people who are on long-term steroids or immunosuppressing agents, or they have certain conditions including cancers, or they are on chemotherapy. But definitely we are seeing a large surge of these fungus cases in COVID patients. And the most common reasons would be that we are using steroids in these people, and the steroids are causing a lot of hyperglycemia, which is increase in their blood sugar levels. They are going out of control, which is a very good medium for a fungus of this level to grow inside their bodies. Now, why this surge of the fungus, which didn't happen for so many years when we have had so many cancers in the country? This is a question which we are searching the answers for at the moment. Yes, definitely there are certain theories, but they are just theories at the moment. So we do need to look into the reasons which are causing the surge of this fungus. One of the theories which has come up is the use of industrial oxygen, which is being diverted to for use in medicinal oxygen. But this oxygen, which is diverted for use from the industries, is sterilized before its use for patients in hospitals. The other reasons which is being seen is the use of masks, which is happening, and people are not washing these masks very often. But my point is that this fungus actually resides in the soil and the vegetation around us, in the dust which is around us. And if we are wearing masks, this is actually preventing the spores from getting into our system. So these are all theories at the moment. We do need to look into the reasons why this is happening, particularly in India, because some people are saying because we have a variant of the virus which is here in India. But we did have the same kind of variant in UK, which did play mayhem with the second wave. So frankly speaking, there is no straight answer to this question, why this is happening at the moment in India. We do need to have studies to find out what actually is the target point which needs to be taken out for the acute surge of these fungus cases. This is a very aggressive fungus, which actually, when divides inside our tissues, it goes into the vessels and causes aggressive dissemination of the infection and destruction of the local tissue, and causing blackening of the region where it is dividing actively, and causes a lot of pain. Now, because of the media reports, there is a surge of patients who keeps calling that we have got the black fungus out of anxiety as well. So we do need to spread accurate amount of information so that people are not actually getting unduly worried. But yes, we need to monitor blood sugars and make appropriate use of insulin, which can keep our glycemic control under a very good vigil, so that we prevent these cases.
Thank you. Dr. Datta, I wanted to ask you, your company is engaged in developing a COVID vaccine. So what stage is it in? When do you think you'll be out? Are you planning to come to India?
Well, we need to take a step back here to understand the approach. So when a pandemic strikes, the intent is to make as much of vaccine as possible and as quickly as possible. There are two. So on answering this question, GSK had a leadership position with the adjuvant, the ASO system that we call it, with which you can actually reduce the antigen dose required. In case of the last pandemic flu, for example, we could reduce it by 1/5. So it's possible to do that. That was available. However, we did not have an antigen candidate which was more advanced than that of some other collaborators. So GSK's strategy at that time was, and I'm talking of March last year, Feb-March, that we would collaborate with antigen manufacturers, so Sanofi, Medicago, SK Biosciences in Korea. So these were collaboration, and those studies are happening, where we would use GSK's adjuvant along with the antigen protein or whichever antigen prepared by the collaborator. So just this week, actually, the results from the Medicago study as well as the Sanofi GSK vaccine study have been published, and they look quite promising. But now we need to get into the larger phase 3, because when you come to a full development, you will need to have a good sample size where you can get it better informed about the safety and the efficacy of the vaccine. So that is starting as we speak. The target timelines are hard to predict because it depends on what science will show us, but also what regulators will ask for and how fast they will react. Expectations are that by Q1 of 22, we should, and one of them by end of this year, the vaccines should be available. But besides that, GSK also has a project which we call the Multi-Valent Vaccines. So knowing that there are going to be these antigenic shifts that we have already started observing, right now evidence shows that existing vaccines are still protective to a great extent against whichever strains are mutating as of this moment, right? Now, two things can happen going forward. One is the virus mutates in a way that it increases transmissibility but reduces pathogenicity. This is what happened with the H1N1, what we call in India as the swine flu. And that then becomes God's own vaccine. It infects a lot of people, it doesn't cause that much damage. On the other hand, it could also happen that the virus continues to mutate as it is showing now into newer mutants, one of which someday might be able to successfully bypass the vaccine antibodies. So we are studying on that level as well. That product is more likely to appear in 22 because that will need more data, more information. The good news is with the new technologies that we have, and that is something I should have said before, you know, the newer vaccines like the RNA-based vaccines that we talk about, and we have a platform which is known as the SAM, self-replicating messenger RNA, which in layman's language is very, very similar to sending an email to the body. You send a program into the body cells receive the program, self-amplify it, and thereby you start manufacturing the vaccine within the body. So each human being becomes a vaccine manufacturer for himself or herself. And today's, say, Pfizer or Moderna vaccines also employ to a great extent this very, very similar mechanism. So the SAM platform-based vaccines, we are anticipating results by 2022. And once it's available, of course, phase-wise, it goes all around. GSK being a global company will not limit itself to one or two countries. I think the guiding criteria at that time would always be the unmet medical need. Because for a pandemic, that's what you need, right? So this is the philosophy as of now, and all of us are working on that. We have big teams which are addressing that issue. We also need to be, of course, cautious that these are expensive endeavors. You know, phase 3 researches can cost you tens of millions of euros, right? So that business element, obviously, if not as a profit-making enterprise, at least at a break-even enterprise, that element, not my team, but other teams would obviously be addressing, right? We can collaborate, and we are collaborating with a lot of institutes in various countries, where some of the science is done in the institutes, so that speeds up the whole thing. We recognize that as a company alone, we don't have all the expertise in the world, and we cannot. So we are happy to have that expertise if part of it is available elsewhere. to become collaborators through whichever deal or discussions that take place, starting right from takeovers to a partnership to a collaboration to a joint venture. So multiple possibilities exist in that arena. Again, out of scope for my function, but I know there are people who deal with that.
Right, thank you. Mr. Poonawala, you have been helping out people a lot with oxygen and beds and all of that. Right now, when we look at the Delhi government bulletin, the numbers do seem to have come down. Are you also seeing a proportionate decrease in the requests you were getting, or like we keep hearing? I mean, is the situation still pretty bad?
The situation is actually, I think, worse. Yes, Delhi, which is the focus of the media, cases have gone down, but rural India is absolutely suffering. And rural India does not come on social media. It's more on WhatsApp, so it doesn't get highlighted as much. But rural India is far worse off. There's less testing, there's less death certificates, there's less reports happening about what is happening. And we know how governments, state governments try to control media from going and reporting there. So rural India is actually in quite a crisis. What should be worrying, and they're all experts here, is if the number of cases are coming down, but the death rates, the number of deaths are the same or has actually slightly increased, the death rate has actually increased, which should be more worrying for us rather than celebrating the number of cases has come down. So I, for one, don't believe cases have come down. What is in Delhi, what is worrying in Delhi is the black fungus cases. I think that is what seems to come out. There again isn't sufficient research on that, but a lot of theories suggest that the unscientific approach by using tocilizumab and remdesivir and other steroids on patients who had even mild COVID has resulted in this, or it seems to be that. We need more scientific data to put before ourselves and the world. And I think that is where this is lacking.
Right. Um, Thank you, Mr. Poonawala. Dr. Shaktibhan Khanna, if I may come to you. Ma'am, I mean, this question may be very basic, but I still had this. So some vaccines have been associated with blood clots. And now even in India, we have had this report which said that we've
Yes,
had, I mean, very few
yes.
cases, but we've had them.
Very
So
rare, very rare.
yeah. So, what I wanted to ask you, ma'am, is that are all vaccines equally safe for women of menstrual age, or are some vaccines more safe than others?
All vaccines are safe for a woman in menstrual age. Any vaccine can be used. There is no problem in that. We are only bothered about the pregnant woman in whom which one should be given. Otherwise, you can have any vaccine.
Okay.
And the blood clot, what you are talking about, is a very, very rare complication. 1 in a million. That means nothing. That can normally happen for any treatment, any injection. Because we are talking these days about vaccine, so we are all bothered about vaccine. But there are so many medicines we can give otherwise in a person, and they can have these problems. So that is not a big problem.
Mhm. And what about lactating women, ma'am? Should they
Yeah,
take?
yeah, we are giving them. We are giving. Even Government of India has accepted that, and even when we go to RCOG, Royal College, America, they are also giving. They are also giving for pregnant women, but in the not in the first 6 months after that, and it has to be only Covaxin rather than the other one. That's what is their recommendation. So let's hope that we also here will have soon the recommendation for pregnant women to have the vaccination.
Okay. Dr. Kantru, I wanted to ask you, is there any estimation of the number of patients, post-COVID who need to be on oxygen? What percentage require oxygen, for how long do they require oxygen? Because that's, I think, another thing that has added to the oxygen demand.
See, the number of serious or moderate cases who go on to the oxygen is somewhere between 50 to 80%. We have seen in the first wave back in 2020 also. So this number almost remains the same. We might think that the number of people who come in to our center very short of oxygen is large at this moment, because the whole number per se is huge. The number of people who are affected with COVID-19 in 2021 is way more than what was there in 2020. May have been many reasons, one of which was early lockdown in 2020. So 15 to 20% of moderate to severe go on to the oxygen, out of which the moderate cases, they do get better very well and they go home without oxygen. Now, there is this strata of around 3 to 5% who might need oxygen at home as well. So this is a very small strata as compared to the population which we have, and there is a very nice initiative now on the part of government, maybe a little bit late, but it is there. People who cannot afford these oxygen cylinders or the oxygen concentrators, now we have a message at our center that who cannot afford can be given oxygen concentrator free of cost if they want to go home, to get better, to be with their loved ones earlier rather than later. So we do have this message from the government now that they can be sent home and the oxygen concentrator can be provided by the government, which is a good move. But the number of people who require oxygen at home is very less. It would be somewhere between 3 to 5% only. And this is due to a large number of cases because these patients do require about 12 weeks to get better with their lung problems. So this is not something new. This we have seen in the first wave also. So there may be clots happening in these patients per se with the disease which happen due to clotting in their vessels inside the lungs. So that may be another reason that they might be on oxygen on a longer term. So these are some of the few reasons that people go to their home with oxygen support. But I think most of my patients stay on oxygen for about a week to 10 days when they go back home, and they are weaned off very nicely and they recuperate very well.
Okay. Mr. Sandhu, Mr. Harjeet Sandhu, you wanted to come in?
No, I am there. First, I would quickly like to say that sometimes if we have made mistakes or whosoever has made, admitting mistakes itself is half the job done. Because if you are not admitting it, you keep on being defensive. So your focus is not on improving. Your focus is on how to defend yourself and how to put other people who try to raise those things. I think Mr. Poonawala did raise it in the beginning, but unfortunately, he was interrupted. So I think in that it's not political, because in the first session we had some very eminent doctors, and here also we have even more eminent who are on the vaccination side. So politics, of course, but in my opinion, what Mr. Poonawala was saying had nothing to do with his own politics. He was just trying to see where we went wrong. I put it in the previous one on a side that this Magic Remedies Act and all, so many advertisements are going there. Big people are going and releasing those products by Baba Ramdev, and nobody is taking action under that Magic Remedies Act. We made that act way back in 1954. I am a police officer from India. I know that. I have arrested a lot of politicians from every party. So I'm very secular. In CBI, I have arrested every party's politician. So, Mr. Poonawala, you can rest assured, for me, we have good and bad people in every party. So that's not an issue. No, when I raised it in the first one, somebody is talking of Gomutra, Gobar Kaleb. Nobody officially, I raised it in the first one also, but now we have the vaccine experts here. I'm raising the same. Nobody officially is challenging it. Nobody in the government agency, whether it is this party's government in a state or whether it is that party's government, some journalist is arrested who said something against that Gobar Ka Lep and Gomutra. So while we are developing vaccines, Mr. Poonawala is doing his best. Anil Datta mentioned about what in the maybe next year we are getting, and we also heard. So we simultaneously have to tell people that this nonsense they have to stop. People are dying because of taking this Gomutra and Gobar Ka Lep and whatever it is. They're taking so many extra steroids. I'm on several WhatsApp groups, official, my IPS group, India Top Gov group, then my batchmates of IPS, some of them who have retired recently as DGs and commissioners from all over, including Director CBI. So all these people also
keep on forwarding absolute illiterate WhatsApp messages. So nobody officially is challenging it. The moment somebody starts challenging, oh, you should be put in this confinement, or NSA should be applied on you, or that one should be applied on you. I have used, I mean, I have even thrashed some politicians, sorry to say that, because if they are creating problem, land order problem, they get thrashed. So you have to stop it that. Nobody is doing it. Unfortunately, this blame is not a blame game. We say in police, I'm now retired long back, we say for solving any problem, you must first admit that there is a problem. And if there have been some mistakes in the handling of that problem, those must be first identified, and then you go for what is the solution so that we can stop that. And stop giving, if a big man gives a statement that Ma Ganga will wipe away Corona, there will be no Corona. Believe me, you are from same India, I'm from same India. A million people will trust that big man's statement. They say, oh, that man said, there is not. Baba Ramdev says, this is all nonsense, no need of oxygen cylinders, concentrators and all. Aditya knows that how much this, we have been working on this, thanks to Aditya, trying to get oxygen. Italy has sent big flights. Ambassador Vincenzo Di Luca is a good friend. He has arranged so many shipments. Rest of the world is trying to get these ones, and our own people, whom billions and millions are following in India, they are saying that you don't need oxygen. So then people sitting here think their own people are saying we don't need oxygen, and from here we are sending the oxygen plants there. The Noida plant is installed by Italians there. It has to be stopped. Now, how many people will die by listening to his dad's speech where he said, oh, even if you are infected, he said, somebody having that SpO2 level of 50, I gave him Kapal Bhati and it increased to 90. The person will die in no time. I'm from medical background before going to police. I have studied physiology, I know that. Again, these things keep on continuing. I'm sorry, I got little emotional on that, because sitting outside, you feel more emotional, because you have to defend the country. We are not criticizing, we have to defend it. We are here discussing only the problem. So I have raised these issues. I leave it up to the experts to handle these. So thank you very much.
Thank you so much, Mr. Sandhu. But that brings me to a question, possibly the last question, and any of the doctors on the panel can take it. Can one really boost immunity? Is there something called an immune booster, and does it really work?
Yes, you can. Take vitamin C, take zinc, take high protein diet. That will improve your immunity. These are the medicines which you are giving.
Yeah, I would put it in another way.
Yeah.
I got there are two types of immunity you need to think in mind. One is the innate immunity and one is the adaptive immunity. Adaptive immunity is the one that the body adapts subsequent to exposure. Innate is something we are born with, right? So in adaptive immunity, it's a function of stimulating the immune system, which on one side will create proteins, antibodies, on the other hand will prime the cells for a cell-mediated immune response. More than enhancing immunity, I would say you can take standard measures to avoid immune suppression. That is certainly possible. There is evidence to show that some trace elements like zinc and all of these, they certainly help in supporting the immune system. They do not create immunity. That would be a wrong thing for me to say. Immunity cannot be created out of thin air. So the body has to receive an insult and react to that insult and thereby produce the appropriate immune response, humoral or cell-mediated, right? But a good lifestyle, taking care of certain diseases like diabetes, like renal failure on steroids and all the other things Dr. Kantru mentioned about immune suppressants, cancer therapy, all those things can most certainly help. The only true pharmacological way of boosting immunity is going to be giving immunoglobulins, which we give to hypogammaglobulinemia or agammaglobulinemia patients. But there's no drug as such that if I take, I'm going to get immune against COVID or cold or anything else. Like people have talked of vitamin C, people have talked of zinc. These are more to maintain or support the immune system rather than to stimulate immunity against a organism.
Yeah, Mr. Poonawala, you wanted to come in.
I just want to add one point to what he said, and that's important that we understand this. And I hope, therefore, when we end this panel, we start, as Mr. Sandhu rightly said, questioning more. When the health minister released a Baba's Coronil product that claimed to not just cure COVID, but now is being sold as something that can prevent COVID by building immunity. And as he rightly said, immunity cannot be built. You see, I'm a politician. My job is to criticize. I'm in the opposition. But you guys are the scientific people. It is a democracy. You've got to question. And if you don't do it, you're doing a disservice to your profession and to this country and to humanity. You know, in March, the government said homeopathy cures COVID. It's the official release of the government of India. Homeopathy. So you guys have to do it. We are not the experts. We depend upon you. You guys have to train us.
Thank you so much, Mr. Poonawala. Thank you to all the panelists. It's been a very animated discussion. Thank you, everybody. Thank you, Aditya.
Thank you, Aditya.
Thanks for having us. Thank you.
Thank you. Thanks a lot.
With this, I would like to thank all the distinguished speakers who have spoken and enlightened us with their knowledge. It was a great discussion. Now, to sum up, I would like to mention a few points that have been mentioned by the speakers. Preeti Sudan ma'am have specifically focused on the need for surveillance alerts. It was reiterated by Tehseen Poonawala and also Rashid Chotani sir. Rashid Chotani sir has also mentioned that it is a humanitarian crisis that India and the whole world is currently facing. He also mentioned that there is a need for surveillance of genetic markers. Damu Ravi sir, on the other hand, mentioned that how the nature of diplomacy is changing and the need for supply chain, which is cross-border supply chain, is essential. Then Anil Datta sir mentioned that we must spread a positive message on vaccination. We also had with us two frontline workers, Dr. Shashibhan Khanna ma'am and also Vinnie Kantru ma'am. They both mentioned that how there is a need to spread correct information. Also, Vinnie Kantru ma'am spoke of vaccine hesitancy among users as well as the producers. And then Dr. Shakti Bhan Khanna ma'am also mentioned a very important point that we should focus on prophylaxis rather than cure. With this, we have come to the end of the second session. I thank you all on behalf of the GCTC team. Thank you.